Anyway, just for people's information, I was called to a press conference with the Health Minister of Ontario, Dr. Eric Hoskins, and the very good news was that the province has agreed to fund $450,000 worth of staff for us. That will mean 4.5 people to implement our drug overdose plan. They will also be funding 80,000 naloxone kits for the province of Ontario, and a good number of them will go to the city of Toronto, of course. And within that, the public health units across Ontario have been designated as the institution that will be managing the naloxone distributions in their jurisdictions. So that's a good thing as well. So I think frankly, the province has done some good listening on the issue of drug overdose and the harms that come from that, of course, and the deaths that have come from that. And they have responded very well with a plan and also with a good amount of money. So that's. And the people who clapped the loudest actually deserve to be clapped for, because they provided the impetus and the encouragement to keep us on the straight and narrow. So right back at you, back there. Yeah.
Zoe Dodd was there and said, "Be careful what you wish for." Zoe Dodd is the founder of Moss Park Overdose Prevention Site, which gives rescue breathing, oxygen, no chest compressions. Because Zoe's saving non-drug overdoses and drug overdoses, teaching people to get rescue breathing. June 12th, press conference at Toronto Public Health's head office. Chest compressions only. More chest compressions only. No rescue breathing. January 9th, 2017, Mayor here, John Tory, with the Associate Medical Officer of Health for the province of Ontario, Dr. Barbara Yaffe, said it's rescue breathing. John Tory's quoted, "This is what causes people to lose their lives, quite literally." Yep, non-drug overdoses and drug overdoses, because the signs of drug overdose can mimic any of the hundreds of causes of breathing emergency. And if you've got a breathing emergency, chest compressions and deny rescue breathing is murder on both counts. For some reason, millions of you are following this mass murderer's instructions. Dr. Eric Hoskins, MD. Far left here, that's Joe Cressy, the new chair of the Board of Health, who tells me to shut up and cuts my microphone while making deputations at the Board of Health. He knows I'm trying to save his life and his family member's life, and it's illegal to tell someone to shut up and cut their mic. You have 5 minutes to speak.
Was the CEO of the Canadian Helen Keller Society, and I just feel sorry for the people that cause themselves needless deafness and blindness. There's this deals issue with the funding for HIV and harm reduction and child youth resiliency. So we need a lot more funding for harm reduction, HIV prevention, etc., and children resiliency. But Toronto Public Health has spent a lot of money on a program that's costing you a fortune. Public Health has just started 25 training sessions that are going up around this city. They have a capacity for 1,200 people. It's the naloxone program. They are not distributing naloxone at these events, but they're teaching all people all the signs and symptoms of respiratory emergency. Then chest compressions is included. As Dr. Davila just mentioned, eating cannabis causes you to go into respiratory failure if you get a large dose of edibles. So, I'm just trying to save lives. That's a no-brainer. There's over 1 million people taken to the hospital per year with a respiratory emergency. They need respiratory assist. Anyway, you guys have a great one. I hope Mr. Hoskins, you got him straightened out.
This is June Fest. 12th of June 2017. Deaf Blind Awareness Day. My mother, deceased. CEO of the Canadian Helen Keller Society and the founder of June Fest, Deaf Blind Awareness Day. And I watch everybody make themselves sick because they instinctively know what they've taught millions of people is murder. Breathing emergency. A, rescue breathing, or B, chest compressions. Think. Huh? You know it because you've all had a breathing emergency. Hitting the chest, eh? Makes it hard to breathe, eh? Hitting the stomach, hitting the throat, hitting the back. Hundreds of causes. Run too fast. Get on an airplane, a mask falls from the overhead. Do you take the oxygen or do you pound on a beating heart? June 2013. Heart and Stroke Foundation sent me this letter and they CC'd it to Public Health about chest compressions. And chest compressions only, which any child should understand, is for a cardiac arrest. There's less than 15,000 out-of-hospital cardiac arrests per year in this province. There's over 1 million people taken to the hospital in need of oxygen per year in this province. And a doctor or a nurse or a paramedic can't tell what's causing the breathing emergency except give rescue breathing ASAP, diagnose, then treat the underlying cause. And I watch you all make yourself sick. Denying what a child knows. I know it at 5 years old. They call them breathing emergencies because that's exactly what they are. There's nothing wrong with your heart. They're breathing emergencies. This is a pamphlet. Zoe Dodd. She works at the South Riverdale Community Health Center. And it's rescue breathing for any of the hundreds of causes of breathing emergency. Yet millions of people, for some reason, are denying rescue breaths and giving chest compressions to people who are alive. That's murder. Plain and simple. Premier Doug Ford. I tried to save his brother Rob Ford's life back in 2013. I had a meeting with Joe Mihevik, the chair of Board of Health, Rob Ford, and myself. Joe says, Rob, that's Gary Thompson, he's trying to save your life. And Rob walks by me and growls at me. And there's the President of the United States, knee on Statue of Liberty. I can't breathe. Blood dripping off him. So I phoned the White House. And you get the Secret Service are on the line every time you phone the White House, and every Secret Service agent has first aid and knows what they've taught millions of people in the United States and Canada is nothing but murder. Deny, rescue, breathe, and pound on a beating heart. I've talked to thousands and thousands of you. Your body language alone gives you away. It's called cognitive dissonance. Lie to yourself and lie to others in order to protect a core belief that the government and the medical profession are not mass murderers. The exact same thing happened in Nazi Germany. Lie to yourself, you make yourself physically and emotionally ill. And it's also psychological terrorism, workplace harassment and bullying, needless death, stress, increasing mental and physical illness, drug use and misuse. Read the comment box and then think, because you already know what's going on.